needs to cut back on finances to affect the quality of your care. This week, the board is kicking off its White Coat Deception campaign. And here to talk to us a little bit more about what that is Cosmetic Surgeon Dr. Dave David. Nice to see you.
Nice to see you, too.
We're so glad you could come in to see us. Glad you weren't affected by the craziness this morning with all this weather.
I was going to say the white coat warning should be a white air tube warning.
Isn't that the truth? What exactly is the White Coat Deception campaign?
Well, there's a campaign going on basically to say that people, Kim, who are going to get any kind of cosmetic surgery, check out your doc, check out your surgeon. Don't try to go for the lowest budget, the best deal you always get. Basically, whoever does any cosmetic surgery should either be a plastic surgeon or a cosmetic surgeon. There's sort of two different pathways to take, but as long as they're experienced in cosmetic surgery or plastic surgery, that's really the way you want to go.
But at the same time, you want to sort of do your homework on these individuals, right? Because someone may be board certified but not be so great at what they do, right?
You're absolutely right, Kim. There are good doctors and bad doctors in every specialty, and a certification just means that they passed tests, they went through certain courses. But, you know, for instance, with cosmetic surgery, you have to have a good eye, aesthetic eye. That's something that can't be trained. That's something that can't be taught. And experience is a big thing. You know, has your doctor done one or two of these cases? Has he done 1,000 of them?
Sure.
And I think that's very important.
I would say probably patient word of mouth is another great way to get your information.
You're absolutely right. Before and after pictures from the cosmetic surgeon or patients who have actually had it done, and especially if you knew the patient before they had it done, and see what they came back afterward. I mean, the cosmetic result's important, Kim, but also lack of medical complications is important, and a lot of it has to do with the experience of the surgeon.
Right. Which was the next question I wanted to ask you. What could be the results of maybe going to someone who is not as qualified as they should be?
Yeah, well, that's tough. I mean, the less qualified the doctor will be, the higher chance maybe of getting complications, either medical complications or maybe just not getting the cosmetic results you want. Those are probably the main thing. I divide everything into two things: your cosmetic results and the likelihood of any medical complications. And you want the doc that, you know, you can never eliminate either of those two things, but you want to really reduce your risk in either of those cases.
You want 100% on both sides.
Of course you do. Everybody wants perfection. I always tell patients, you know, the result of cosmetic, or the goal of cosmetic surgery is not perfection but improvement. And everybody has different concept of what they want. You could do the exact same thing to two different patients. One will love it and one will say, oh, you know, could you get a little more fat out of here?
Sure.
So everybody has their own expectations.
Sure. Let's go back to the idea of these being tough economic times. Unfortunately, this does, in some cases, force some women and men, patients we'll call them, to maybe turn in directions that they wouldn't have otherwise.
You're right. You know, the tough economic times works two ways, Kim. A lot of people say, well, how's your practice doing with the economy? Are people getting fewer elective procedures? But it's really funny, because of the economy and people having to compete with younger people in the job market, some people, let's say men who are getting Botox or fillers and so forth, are men that say, I would have never gotten this done before, but I need to compete. But as far as if you, let's say, because of the economic times, try to cut corners with who you have do your procedure or which procedure you get done, that's not always the best way to go. It's not like you're buying a car. You know, you just don't go to the lowest bidder.
Sure, right. So maybe if that is the case, then you need to think it through if this is the right time for you to have something like this
right.
done.
Maybe, you know, I would rather have a patient wait until they can afford to or choose to spend the money to do things the way they want to do rather than cut the corners.
Now, I hate to be so dramatic, but when we talked about what could be the result
You're in the news.
of...
You have to be dramatic. What are you talking about?
What could be the result of choosing the wrong doctor? We have reported on cases, unfortunately, of young women who have turned to doctors who were the wrong doctors, and the result was death. And it can be that dramatic.
Yeah, it can be. I mean, I guess even death can happen even in non-elective, you know, minor surgeries, you know, God forbid. But yeah, that can happen. The big thing is a doctor who's experienced, a doctor who's well qualified and certified in whatever procedure you're getting done. Everybody can't be everything to every patient. The more procedures a doctor does, the more different procedures, you can't be a real expert at every one of those. So maybe a doctor who does more of a few different procedures can get to be really an expert at one of those procedures.
Well, some great advice from you. And so if you need more information, you certainly can do so by visiting drdavedavid.com. You can check the website if you need more info. It's good to see you.
Great to see you, Kim.
Travel safely home,
Swim home today.
Swim home. All right. Cindy, up to you.